I'm really glad we've started. There's so much interest and so much debate and feeling here, which is wonderful, because we're now getting to a position from talking statistically, research, very out there, we're bringing it here, what your opinions are, what your experiences are. And it's just a small indication as to how emotive this subject is. Before anything else, I'm pointing towards my nose now. Right. Before anything else, I'd like to just say that somebody contacted me last night, literally at 10 o'clock, a woman who lives in this community, and she said, look, I really, really want you to say this to them. And she recorded an audio. I don't know if you'll be able to hear it, but I said, look, okay, I'll play it. And I've sort of changed the voice around so her voice is not recognizable. But I just want you to hear this before anything else.
I have to accept now that this is my life, a life without any love, okay?
The sound's gone. What's happened to the sound?
Oh, that's why. Yeah. Stick that on your. Can you put? You haven't got a pocket, have you?
No, just put it here.
No, not that. That's all good, yeah. You can't click away from it.
No, no.
Do you want it on the screen?
No, it doesn't have to be. It just needs to play it.
Okay. You got full volume.
Yeah, it was working.
So hold on.
Start again.
Sounds really ominous, doesn't it? Okay.
Okay, let me try.
I have to accept now that this is my life, a life without any love, okay?
No, for some reason it's not working. That's a shame. But this is somebody who really wanted her voice to be heard and for people to just kind of get a sense of what life is like for her. And she's living in a very difficult marriage. And she's somebody who isn't experiencing domestic violence necessarily, but on a day-to-day basis experiencing such levels of stress that it's impacting her on a day-to-day life, on a day-to-day basis. But I think we'll go on, we'll move on because that didn't work. Right, can you see that? Okay, so I'm going to be generally talking about how general marital stressors, generally beliefs around marriage, just the whole topic creates a lot of tension in us as a community, as individuals as well, as families. And I'll talk a little bit about the general population in terms of what sort of stressors there are in the general population, but I'll also talk a little bit about the clinical population. So I'll use a case example to talk about how marriage was one of the contributing factors that led to mental health problems in a case I worked with a while ago. I should also say, if things are brought up for you after this, feel free to email me and I'll direct you to NHS services where you might get some support, or if you know somebody who's affected and if you're sort of wondering how to get support from them, by all means contact me afterwards. My email address is there, and yeah, I'll direct you to NHS services. So the aim of today's presentation, and I'll be about half an hour, hopefully no more than that, is to draw on cultural religious beliefs about marriage. So we're talking about opinions here, everyone's having sort of saying, oh, but this, but this. But actually, I come from a position of social constructionism, which means that I have a set of beliefs, I have a perspective, but that's all it is, it's a perspective. And I don't believe that my perspective is any more important or significant than any of yours. Or, you know, I mean, Salam Jones earlier talked about people with letters behind their names and after their names and all sorts of things. But actually, you know, I think that all our experiences, all our opinions are valid, irrespective of how many degrees and how many letters you have. So I'm going to talk a little bit about beliefs and why beliefs are so important when we talk about mental health and marriage. I will talk about the common stressors associated with marriage, which everyone will be sort of familiar with, but actually I would like to touch on unconscious stressors as well, conflicts and unconscious conflicts. And as I said, I'll use a clinical example, but I'd also like to maybe think a bit about, or raise questions really, rather than coming up with solutions, raise questions about what we as a community can do in terms of preventing mental health problems due to marriage stressors, what professionals can do, what community members generally can do. This is just a picture. That's not a real person that I know, but it's somebody in the community. Actually, quite a few people were very interested in contributing to this who were not able to come today. And one person gave me a quote, what marriage was like for her. And this is somebody who had a love marriage. She fought very hard with her parents to marry this person. And after being married at 10 years or so, she wanted, rather than using dictionary, I wanted to get the real experience and real qualitative description of marriage from somebody. So she said, marriage was possibly the hardest task one assigns up to. Nothing can compare you for the highs and lows. After being married more than a decade, I'm still learning new things about him. A compromise is always necessary, as love simply isn't enough to carry the marriage. And in this case, there was love in the beginning. And even if there was love, we heard earlier there, it's really hard. It's a hard process. And even under the best conditions, even, we saw the pictures earlier, beautiful Bollywood-type pictures, everyone looking beautiful and happy. Even under those conditions, post-ceremony, the process of living together, having children, all sorts of practical financial pressures, it's a difficult process. And this person who beautifully illustrated that, actually I really wanted to use that. Another person said to me, I always wanted to be married with children. My parents and I agreed on this. The difference, they wanted an arranged marriage, I did not. I lived away from home, leading a double life. I met my child's father at a party and fell in love. 5 years into our relationship, I yearned for us to have a child. I became pregnant, told my parents over the phone at 5 months. Having a child with an Englishman was going to bring its challenges, but I did not prepare being a mother without any parents and extended family. This was a very professional woman. She's still working now in the NHS, and she said, Sidrah, at least I would be heard. That's what she said to me. Because she's been very ostracised by the community for A, living with a white man, this is a few years ago, B, getting pregnant and having a child. Even though she went to a mosque and did niqab, which is the Islamic marriage ceremony, it just wasn't recognised. Her parents completely disowned her. As a result, and there's other factors, but this had a direct impact on her mental health. Her relationship deteriorated, her partner and her, they split up. And she was on antidepressants and had counselling, which got her through. In the end, she had to redefine the concept of family for herself. Her parents were not in the equation. She managed to get some support from her siblings, who were more sort of her peer group, her age. And it's just an example of somebody who actually isn't particularly part of the sort of norm within the Bangladeshi community, but she very much sees herself as a Bangladeshi woman who just simply couldn't conform to the norms of Bangladeshi culture as she saw it, as her parents saw it. So religious beliefs, just to basically say something about religious beliefs from my perspective. So marriage is seen as fulfilling religious duties and having a family. Now we talked earlier, somebody mentioned people get married and often go to religious pilgrimages. In fact, majority of Bangladeshi, I think 500,000 in 1991, according to the census as far as I remember, 500,000 Bangladeshis in Britain, most densely populated population is here in town hamlets. Majority are Muslim, with a minority of Hindus and Christian. Now, according to Islam and Hinduism, marriage, and actually other religions, but really talking about Islam and Hinduism, marriage is seen as sacred. For Hinduism, marriage is seen as a way of spiritually growing with your partner. According to Islam, actually, you fulfill half your religious duties when you get married. So you can see the significance and importance of marriage as if you are a Muslim. Yeah. So it's seen as so important. So if you don't do it, there's implications in terms of how you feel about yourself as a person. And in terms of having families, having children, according to sort of religious and cultural beliefs, you have children. If you have children outside of marriage, as we saw from the earlier quote, there's serious consequences. Now, marriage is also a form of strengthening family ties. We talked about cousin marriages earlier. If you think about it from a survival perspective, people who get their sort of child married to their brother's child, somehow forming sort of an alliance between two families. From a survival perspective, or evolutionary perspective, I guess there's a real sense of survival in a group. So you're not isolating yourself, you're somehow forming kinship, you're forming cohesiveness, you're forming group strength. And if you think about people, for example, Bangladesh, post-war, for example, famine, poverty, when people come over to a different country where they're isolated, where they're feeling emotionally and physically threatened, the idea of cousin marriage can feel very appealing for parents who are wanting to preserve their safety, really. They want to feel emotionally safe, they want to feel supported with as many extended family members as possible. So cousin marriages often happens, in terms of strengthening families. Marriage is also a way of curbing sexuality in a social appropriate manner. We've briefly touched on honour-based killings, forced marriage. Now, often this arises because there's some kind of socially deviant sexual behaviour. And one young man I worked with a few years ago, he was very, very unwell. He was very psychotic, and he was a highly intelligent, handsome, really articulate young man, and he had a huge, amazing, promising future ahead of him. Unfortunately, he had a very difficult experience in terms of feeling very different and isolated. And from the age of about 15 or so, he found himself drawn to other young men. And as he grew up, his interest in men increased, and to the point that his father was aware of it and became very concerned. And his father was a very orthodox Muslim man who had a very high status in the community. And the father's way of responding was taking him to an imam to give him lots of amulets and religious sermons to kind of sort of straighten him out. That didn't work. He took him to a religious pilgrimage, Umrah. That didn't work. In fact, made him really unwell because he was so overwhelmed by anyone who's been to Umrah will know that actually it's a really emotionally and physically overwhelming process, particularly if you have a disability or if you have sort of emotional difficulties. For some people it's brilliant. For him it didn't work very well and he became very psychotic. But father's ultimate approach was getting him married. So father really believed that if he got him married to somebody back home or here or wherever, a cousin, even if he married a girl that he liked, it was still married, and even if he still had bisexual tendencies or if he was still interested in men, actually just being married in itself saved face for the father. Even if he still remained sexually interested in other men, actually just having a wife somehow created a sense of acceptance socially for him. And marriage is seen as a symbol of adulthood. So I don't know how many people have experienced this here, but even professionally, when I worked in St Clement's Hospital about 20 years ago, the question always arose when I was speaking to Bangladeshi families, are you married? Are you married? Because actually married, what does that mean? Marriage is really a symbol of maturity. It's a symbol of adulthood. In Western literature around adolescence, we talk about marriage, and we talk about, adolescence being a phase where you go through certain stages, one of them being you move out of home, you're financially independent, for example, is a sign of sort of adulthood. So you pass the adolescence phase from the age of 16 to 35 and you become an adult. In Bangladeshi culture, living at home is kind of the norm until you get married. And being married somehow symbolises you have a higher status in the community and you're an adult, you are now responsible. So if you think about people who want to sort of feel good about themselves, if you're 35, not married and seen as someone who's not quite adult enough, there's a sense of failure, the sense of low self-worth. And often I get people in my private practice who approach me, highly educated, very articulate, confident women in their 30s, 40s, who say, actually, I've done all the right things, but I haven't been able to get married, and it's really impacting me in terms of how I feel about myself. It's making them feel low, it's making them feel depressed, it's making them feel somehow just not good enough. And it's not necessarily that people are saying terrible things to them, it's just the overt discrimination they experience, it's the attitude they are aware of, and just they feel bad about themselves. Any thoughts? No? Sorry.
I just think it's interesting that when you bring up sexuality, because I guess within all of this discussion around marriage, there's no space within that, really, it seems, for discussing homosexuality. And I think when identities are so constructed around a marriage and a specific kind of family setup, it doesn't really seem to leave much space for any kind of expression or being of.
Absolutely, definitely. Absolutely. When we talk about marriage, we assume there's an assumption about this is how it ought to be, and this is how it is, and it's heterosexual. And in the Bangladeshi, because this is about a conference about Bangladeshi population, we are very far from there. We're now taking baby steps, even talking about marriage and talking about mental health and how marriage affects us. Actually, that's even talking about heterosexual couples before marriage is a real issue and attention. So if we think about it developmentally, if we are thinking about how as a community we're progressing in terms of talking about these things, we are at a very early phase. And I will go back to what I said earlier about truth. What is the truth? What is the right way to see life? And what is the right way to conceptualize a relationship? And I take a very social constructionist approach. It says there are different ways of being in the world and seeing the world. And we are one community, we are one individual. And we will see things from our own perspective. As a community, we might have some collective perspectives. But these things change and shift with time. Yeah?
Yeah, I guess, I just kind of have a concern for, I mean, there must be lots and lots of, gay and lesbian and transgender and intersex Bangladeshi people who feel very kind of... Absolutely,
and there's some people who find it very difficult to access services and be open about their difference. And it is an issue of difference, feeling isolated, feeling marginalised. And actually the real concern is that again, to do with stepping out of the cultural norm, like that person who said that she had a child out of wedlock, really it's about the repercussion from the community, repercussion from families, friends, stigma, and really how it affects your life. So people often don't speak out, people often don't come out and say things that they would like to say, which will potentially create animosity towards them. Potentially there'll be discrimination, potentially there'll be a lot of difficulty. So it's a real tension, and I think as a community it's something that I would like to see being talked about a bit more. Okay, so marriage-related stressors. The real issue we have often is the pressure to get married. So we talked about the beliefs and why the beliefs are important. As you can understand, pressure to get married in itself is a stressor. So if you're not able to get married, if you have a disability, if you are too educated in some instances, if you just haven't found the right partner, the pressure to get married in itself can cause a great deal of anxiety. And of course, when you're very anxious, you often don't, if you're too anxious, you don't perform in a certain way. When you're too anxious, when you meet somebody, a prospective groom, or if you meet someone in a party, you are unlikely to present yourself in the best way possible. If your confidence has been knocked and you're feeling really like, oh, I can't find somebody, it's unlikely that you'll be able to talk to that person in a way that warrants further interest from them. So again, you go to this perpetual cycle of actually not being able to meet somebody because your confidence has been knocked. And your confidence has been knocked because you can't meet somebody. And it's very difficult when you're at that stage. And we've already talked about the stigma for unmarried divorced men and women. Yes, there's differences and there are changes. There are more divorces and people are more accepting of them. But the reality is that people who are divorced experience high levels of stigma and discrimination. And there is it's sometimes said, sometimes unsaid, criticism and negativity and often blame towards people who are divorced. Yeah? I won't go into too much because it's been talked about. And expectations. We looked at the pictures of big weddings and the expectation to have children, which is very, of course, important, but very difficult for people with infertility issues. That there's a huge, I often talk about how men's issues, men's emotional health is often not talked about, it's often hidden, because men access services differently, men talk about these things differently. And for a lot of men, the sort of pressure to financially support the wife and the family is immense, it's huge. And I don't think we often realise how it can impact on a man's sense of self-esteem, his sense of manhood, his self-worth. Because in the community, in Islamic practice, for example, there is a real belief that the man, and this is sort of in terms of roles and responsibilities of a husband and wife, the husband's role is to pay for the family, the household, the wife to maintain the family. And often women say to me, oh, it's great. My husband I'm not supposed to, I don't have to pay anything in the house. I can earn 100K and actually I can keep it all. And my husband's job is to kind of run the household. That's his job. That's fine. I mean, historically, you can understand why that was helpful because, of course, it protected women's assets and kind of prevented exploitation of women financially. That's fair enough. And in some contexts, it works very well. Unfortunately, the couples I see and people I see, often it creates a real power imbalance. So the husband, when he can't pay for everything, what happens? He feels awful. When husband isn't able to earn enough to sustain the lifestyle that the wife and the family expect or his friends are leading, that's awful for him because if he feels inadequate as a man. And how does that impact on how he behaves with his wife? Actually, he becomes quite withdrawn. He becomes less loving. He becomes a little slightly bit bitter, and that can come out in quite passive-aggressive ways. This is more of a tension, I think, with men who come over from Bangladesh, who have additional financial pressures of supporting the family in Bangladesh. And those men, if you think again about power imbalance, if the woman is from here with a certain status associated with being British, and the man is from Bangladesh, if he's earning less, if he's less established, and in addition he's expected to pay and support family in Bangladesh, if he's not meeting all the requirements of that marriage, how does that impact on him? And we talk about domestic violence a lot. These men often, not all of them, they won't seek help. They won't say, I'm struggling. They won't say to the wife, look, this is a real power imbalance and I think we need to readdress that. No, they will get really angry. So when they're feeling attacked, when the wife is criticizing them because they are not paying enough for the, not paying enough or not earning enough, or you're not good enough, you haven't done this enough in that time, you haven't, my friends' husbands are earning X amount and you're only earning this. What does that do to them? It really knocks their self-confidence, and that power imbalance just gets worse. And in order to rebalance that power imbalance, what the man often does is exerts control, or he gets angry and aggressive, and of course when he does that he feels really powerful and in control, and the wife is suddenly down there. So that power struggle can happen a lot in relationships, particularly when there's, for example for men, when there is real expectations to perform as a man. There's other expectations. I'll just go, sexuality is another one. I worked with a woman, for example, she was not Bangladeshi actually, but this applies just as much for Bangladeshi women. She had been detained in Turkey by the police for about 3 years and experienced the most horrific torture you can possibly imagine. She developed PTSD, trauma. She just, the idea of being with a man for her was absolutely traumatic. But she was also an Orthodox Muslim. So when she came over to this country in terms of asylum, she was on her own as a woman, but she felt from a religious perspective she really needed to get married. She needed to fulfill half her religious duties. She needed to have a husband and children. That's what you do. That's what gets you to heaven. That her belief was very much that's what you do. Despite her trauma and PTSD, she went on. She got married, and it created a lot of tension for her and her husband because sexually to perform, and for her even the sound of a belt was traumatic and it triggered her PTSD symptoms. But from a spiritual perspective, from a cultural, religious perspective, her belief was that if she doesn't meet her husband's sexual needs, she will go to hell, or the angels will curse her all night. That's how strong the belief is, and as a result, she felt that she was a terrible person and she will go to hell. So believing you're going to go to hell was probably the most distressing thing for this woman. So that's why I say cultural beliefs and religious beliefs can be really helpful under certain conditions. Sometimes where people are already vulnerable, they've gone through a real difficult time, those same beliefs can be really quite stressful and can not trigger mental health problems, but add to the contributing factor that then make people develop mental health problems or maintain those problems. I'm going to miss that. Oh, conscious. We talked a lot. We talk a lot about conscious conflicts in marriage, and we just touched on that power imbalance. There's lots of unconscious conflicts that happen. I'm not going to go into this in great detail, but what I want to say is this. Everyone has had relationships with their own parents or caregivers. If you haven't had parents, you've had caregivers. Everyone has had some model in their mind of how those caregivers or parents related to each other. Yeah? Those form a blueprint. So however much you might try not to, somehow or other we end up acting out those relationships. And I can see a few smiles here. But sometimes when those blueprints have been really positive, that's great. You have an initial predisposition to a positive relationship in your mind. You have a good attachment relationships. You have good object relations. You have good you are at an advantage. But if you've had really poor early attachment with your own parents and your caregivers, those experience of caregivers and their relationship was very poor, it's a disadvantage for you because unconsciously you will act out things. So I often see the wife saying to the husband, you're no good, you're this, you're that, and you're selfish, you're terrible, I hate you, you make me feel awful, you make me feel like I'm nothing, you don't give me any attention. You don't give me any attention is always a really important one. The women always say to husbands, and actually you have husbands saying that to women, that you don't value me, you don't respect me, etc. When a woman is angry, and we talk about in therapy when a client is very angry with me, a lot of the anger is coming from the early childhood in terms of how their parent related to them, and they're acting that out in therapy. So often a wife says to and this happens in your relationships, it happens to all of us, we do it. If you're conscious of it, you're lucky. If you're not conscious, it can be a bit tricky. So if a wife is really angry, you're not giving me any attention, you make me feel small. If she had a father or a mother, it could be a mother as well, who didn't value her, if she had a father or mother who criticized her, or made her feel small, or just didn't give her that love she wanted, it is very likely that in a marital relationship or any relationship, in a close romantic relationship, she or he will act that out. So there might be elements of truth in the fact that the man is not giving her attention, he's busy at work or whatever, but the emotional response is going to be affected by those early experiences. So there's so much unconscious conflict going on in relationships. In this room, there's so much unconscious conflict going on. Yeah, we can see from the heat conversations, if you were just left for half an hour, gosh, we'd get worried. But because that's what happens, and that's good. It means that you are engaging in this topic. It's wonderful. Yeah. And I'm not going to talk about this too much. We've talked about this. Forced marriage and domestic violence naturally is a massive marriage-related stressor. It has a direct impact. Somebody asked a question, if somebody has been forced to marry, is there a higher probability that they're going to experience domestic violence compared to those who had a love marriage? I don't think, as far as I know, there has not been a study to demonstrate or evaluate or look at that or explore that. I do know, however, that if you are more forced to marry, your vulnerability to developing mental health increases. If you have experienced domestic violence, your vulnerability to develop mental health increases. Yeah? So often we see in services somebody being forced to marry, they've had domestic violence, all sorts of things, and we can make a correlation. We associate one with the other. But what we don't see in the clinical population is those who have experienced domestic violence but have had a love marriage and haven't come to services. So the data, the statistics, it's very difficult to make those generalizations, but all we do know for sure is that these experiences increase your likelihood of then developing issues. Again, a picture of a man here. I just want to put that in there because the women who came up to me to say, Sidrah, can you use this quote because I want to talk about this, they were women. Men didn't. And men often don't. Men often don't talk about what's emotionally difficult for them. They act out in different ways. And this is just an example of the sort of what I see as men's emotional issues. It's not as accepted. Maybe they don't have the words. Maybe they don't access services in the same way. But actually, they suffer quite quietly. And it's not helpful for any relationship when they do that. Okay, right. I'm going to talk about a case example now. This is a person, I'm calling her Begum. But it's somebody I worked with a while ago, but actually I've made huge changes so there's no way that person would be recognised. And I've made changes, used some other information from another client, again to make, just for teaching purposes. This was a person, unmarried, 22-year-old Bangladeshi female with a mild learning disability. When I say mild, if you met her, you'd know that she had some special needs. From my perspective, it was very mild, because if you look at clinical populations, learning disability, you can have a whole range. And when I say she has a mild learning disability, she was able to dress herself, which was great. She was able to just about make a sandwich, just make tea, handle hot water with some support. And she couldn't obviously hold down a job, but she was able to, she was quite independent, well-functioning. Her global IQ was sort of just on the cut-off, around 70 or 68. And, so that was just on the cut-off. So that's really mild. But it was significant enough to warrant huge reactions from her family as she was growing up and from the community. So the family narrative about her was that she is makal, which means stupid, and who will take her? Like someone mentioned earlier, my sister is so tall, who's going to marry her? How are we going to find someone? There's a stress of thinking, oh gosh, how are we going to find someone? In this case, and that's actually a nice light-hearted, positive thing actually, but this is a real concern for her family, was a concern. Who will take her? Who will marry her? She has matadosh, which is, problem in the head. That's how they described her. Matadosh, problem in the head, mahal, and who will take her? So these narratives about her are very negative. What that did to her over years is just made her very quiet and shy, and she lacked confidence. And later there was other problems, but as she was growing up as a child, she was a bit introverted. And it was not all to do with her learning disability, it was to do with her emotional state. She then started displaying shameful behaviour for the family, which was incredibly shameful. From my perspective, it was actually concerning as well. Not this bit, but later, shouting, putting on lots of makeup, which was for the family stressful and difficult, but, dressing up in a westernised manner. And when I say westernised, family thought it was westernised. From my perspective, it was just inappropriate. So if you wear a bikini in a beach, it's sort of okay. But if you wear something really revealing in winter down the road, that's obviously socially inappropriate. And there was not that concept of context-dependent dressing. Some women choose to wear very westernised clothes. Some women choose to wear certain clothes that their parents wouldn't approve of, but they have the sense and understanding to understand the context. They wouldn't do it in front of their parents in a wedding, for example, where all their relatives are there. They might do it in a different context. So she was just doing things that were warranting a lot of concern. She was also taking clothes off in front of strangers, which was really, really concerning and embarrassing for her family. But the bit that I didn't put into there, I did actually, she was getting into cars with strange men, random men who were sort of saying, do you want to get in? And she said yes. And she would go off for 2-3 hours and come back after being in a car with 5-6 men. And that was hugely concerning for the family, very embarrassing for them, because the community were hearing about it. I guess from my perspective, I'd be very concerned about risk and capacity to consent. If she was having sort of sexual relations, was she really consenting? Did she know what was going on? And she was sort of randomly going up to men and say, would you marry me, would you marry me? So this was really sort of difficult for the family to manage. And actually, before I go to the next slide, it's really easy to look at this in hindsight and look at the slide as if it's something out there. But if it was one of our relatives, if it was one of your relatives, how would you respond? What would be your main concern? I would just like to take one person. And what you hear? Sorry.
I'd be concerned about her psychological state, and I'd want her to access help.
Yeah. What would you do to get her to access help?
I'd probably talk to her, maybe speak to a caseworker if she's got a caseworker, or try and tap into and access some form of help, whether that be I've forgotten the names of these agencies now, but you know, these multi-agency things, or some sort of psychological agency within my borough, I think.
I think she needs a bit of love as well from somewhere. She's looking for acceptance in the wrong places. If she's going up to men and asking if they will marry her, and she's listening from a family that she's not good for marriage, and obviously there's something missing in terms of the connection that she has with her family, and she's looking for, in some ways, love and acceptance.
I mean, it's wonderful. You've mentioned two things between you. One is external support from out there professionals, which is important that you advocate, try and find somewhere where professionals who can work with her. But what you've mentioned is actually highly, highly important. However much professional support anyone, if the support comes from family, if the narratives change about a young person as they're growing up, that can make a massive change in terms of their emotional well-being. So I'll just come back to that. This is a sort of a cognitive model. It's a very simplistic, overly simplistic perhaps, but for teaching purposes I thought that's okay. If you think about what she's thinking as she's growing up, she's developed beliefs about I am bad, I am dirty, I am stupid, no one will marry me and I will be abandoned. However much someone has a learning disability, even when someone has quite moderate learning disability, they develop beliefs about themselves. Those beliefs might not necessarily be the same way that we develop beliefs, i.e. the language might be different. There could be constructs in their head using pictures, whatever. But she was cognitively okay enough to develop certain core beliefs about herself. Things like, I am not good enough, and the real feeling about I will be abandoned. Now, everyone, I mean, many of us have worries about abandonment. What will happen when we are old and no one to look after us? What will happen when you see the wives and husbands? There's always this, I always see this, you left me and you went and I wasn't, there's always a sort of fear in us as human beings of being alone and abandoned. And that's why we often find ourselves getting married. We find ourselves getting into relationships, cohabiting. We form groups. We like to be together with people. And if you think about babies when they're born and when they're very young and the mother leaves them, they scream. There's a real fear of abandonment from your mother, from your caregiver. And we carry that. If you're lucky enough to develop a good attachment with your parent or your caregiver who makes you feel safe and secure, you might, that belief, that feeling, that worry might lessen. But so she had that real feeling of being abandoned. As a result, she was feeling sad, anxious, angry, ashamed, hopeless, frightened, and confused, as anyone would. I think anyone would feel all those things under those conditions, but with her, she had the added vulnerability of having a learning disability. Cognitively, she could not understand the world. She couldn't make sense of it. And this model, and any model, really, you have to always start from the top in terms of vulnerability. She already had a vulnerability, i.e. she had a learning disability. She had a vulnerability in terms of the way she was brought up to believe she is bad, which then in any situation that triggered those beliefs could possibly turn into sort of a cycle like this. As a result of her feeling, she was behaving in this sort of way, crying, shouting, asking strangers to marry her, and taking sexual risk-taking behaviour. So if you think about the sexual risk-taking behaviour and crying and shouting was feeding into her beliefs about being dirty, about being stupid, and no one will marry me, increasing her feelings of sadness, sort of ashamed, and so on. So it was sort of a perpetual cycle. In terms of how parents managed this, parents were very, very anxious, and they're understandably anxious and very confused. I guess from services we'd be really thinking about risk management, but actually in the Bangladeshi community what I've seen time and time again is shame management. And actually I say risk management versus shame management because here there is a real sort of real associate, a correlation, a parallel process going on where the parents actually are trying to minimize harm to her. They're trying to do the right thing by her. So they really tried to reduce the shame by persuading her to get married in Bangladesh. Her husband came over after some time. Unfortunately, it was a very difficult marriage because there was physical and verbal abuse. He was very angry at being tricked into marrying a mad woman. And there was repetitive pregnancies and repetitive miscarriages. She then, not surprisingly, developed mental health issues, challenging behaviour, for example, psychosis, depression and anxiety. Okay, now we're getting to the point of thinking about prevention and support. So how could she have been supported? Any thoughts?
Well, for a start, the stigma of her condition needs to be raised in the community. That's one of, I personally have suffered from bad mental health in the past. I've gone through bouts of depression and stuff. My family have always said, it's crazy, it's just nuts, it's whatever. But I think if more awareness is raised and more people are aware, we would be in a better position to offer her that support that she desperately needs.
Thank you for sharing that. I think it's really brave to be able to say that you experience some of those things. And I think one thing that we can do as a community is to say, actually, I had anxiety here in relation to this experience. I had depression here, and this is how I managed. Being a bit more open about these experiences, as opposed to labeling people as mad, is a really nice way of destigmatizing mental health problems. But that's a continued thing in our community, and generally, I think, that we need to carry on doing. I guess from a family's perspective, what they could have done differently. Firstly, I agree with what you were saying about narratives and actually being positive about her, looking at her strengths, not just her her deficits. So what she's good at would help her feeling more empowered and good about herself. But I guess the family could have gone about finding a suitable match in a slightly different way. They could have still got her married if she wanted to get married. But they could have had conversations with the prospective groom, with his family, etc., about her difficulties, what she can do, what she can't do, so that sets the agenda, so that kind of reduces his expectations. Because one of the things he was really angry about was that she couldn't cook curry and she couldn't do all the domestic things he expected of a wife. From community's perspective, I guess, there's a real sense of shame. The parents did this because they were very ashamed. As a community, what could we do? And you mentioned something earlier about destigmatizing mental health issues and destigmatizing learning disability, making it a bit more accepted. As a community leaders, people in the community knew that she was getting into cars with strange men, and those strange men were Bangladeshi men from the same community. So what responsibility did the community have in terms of addressing what they were doing? Actually. So we're talking about what she was doing, what's going on for her, sorting her out and addressing her issues. What about those men? What would the community need to do? What do community leaders need to do? I don't know, but it's a question. And same neighbours and family members, what support could they have offered? I guess if neighbours gossip and talk and ostracise the family and say negative things, that doesn't actually help the family cope with this. If anything, the family will be pushed into a more sort of defensive position where they are likely to do something rash. And professionals, I guess preventatively, there could have been lots of, in terms of sex education, capacity assessments, psychological therapy, preventative psychological work, working on her thoughts, feelings and behaviours. There's lots of things that could have happened, I guess, rather than the answer is you get married. She could still have got married, but she could have married somebody. She could have had a group of men or a few men to see and talk to, see who she likes. They could, in the arranged marriage way. Just because she had a learning disability doesn't mean that actually she couldn't have a normal arranged marriage in the way we talked about arranged marriage being before quite a helpful way. Actually, for her who has difficulty meeting people and advocating for herself, arranged marriage could have worked really well because that's kind of supporting her to find an appropriate partner, and afterwards supporting her if the family knew about it, if there was understanding that actually she could have been supported to have a happy, healthy marriage. Okay. And that's it. Thank you for listening so attentively, and it's the last presentation. You've really listened and taken part really nicely. Is there any question before we finish?
Great presentation again, but I kind of missed hearing this, so I'm not going to comment on your presentation as much.
but just generally in the community, like when people suffer from mental health, there's a tendency that people take sort of superimpose that he's been possessed by some sort of ghost or jinn or something, as opposed to looking at the clinical side, taking him to the GP, getting him assessed, or a psychologist, and having a therapy, that really helps him or her in that case a little more. People just kind of dismiss them as being mad, or as you pointed out, or possessed with jinns. But there is this other side, which you're pointing out, that there is this Western medical side where they can go clinics and get assessed through psychologists, psychotherapists, and get treated that way. But the problem over there, I mentioned that there is lack of awareness in our community, and there needs to be more work on that. And I guess that should maybe come from guys like you who are in that field, and our community leaders like imams and stuff. They need to be more educated, as opposed to just saying your son or your daughter is possessed.
No, I think I've spent literally 20 years talking about possession and jinn possession and ufri and all sorts of things in Tower Hamlets where I worked, and other places, and written about quite a bit. But what I would say after all this is that...
Just clarify, and there is a concept though in Islam about jinn and stuff. I'm not denying there is a concept, but it needs to be looked into by an imam as well as a medical professional.
Would you like to say any more?
What would jinn gain from possessing a human being? I don't understand that.
What I would say is this, that there's different ways of looking at the world. There's different truths. There's no one truth that's better than another truth. And so if somebody wants to believe in jinn possession, if there's been lots of cases where I've worked with where families believe that the individual has been possessed by a jinn, and that's fine. There's nothing to say that they are less right and I'm wrong, right, they are less right, and the psychiatrists or myself, the mental health professionals are right. But the issue is this. What works for a community, what works for an individual, the belief system that helps you, that what you believe to be the truth is most likely to be helpful if the therapy comes from there. So if you have had somebody in the family or know somebody, or you yourself has experienced something and you believe it's to do with jinn possession, it's to do with spirits, it's not just in Islam, it's in all religious, in many religious scripts. Christianity, demonic possession is very, very prevalent. I've worked very closely with the imams in East London, in Royal London and St Clement's Hospital. In fact, St Clement's Hospital at that time, when it was in Mile End, had hired an imam. And the idea is we worked together so that I could do risk assessments, I could do psychological assessments, and where possible, I used to encourage spiritual resources, spiritual support. For example, one of the recommendations from Ruqya, which is an Islamic approach to treating mental health problems, what we call mental health problems, or whatever you want to call it, jinn possession, or seher, the approach that I take is that there's a lot of recommendations from that source, that belief system, which is very highly in line with what I would say. So, for example, going to the mosque, great, it increases people's social connectiveness, it increases people's spirituality. Ramadan, great, fasting, having a feast at the end. There's lots of practices, really, prayers during set periods of the day can be very contained, very grounding. I guess the issue is that they're not forced into doing these practices, that the family don't impose that. It's really important to give families and people the choice of which therapeutic modality, which approach they want to go for. You have a very medical, psychiatric approach, which believes that mental health problems arise due to biochemical abnormalities in the brain. You have someone like me from a psychological perspective who looks at broad factors and multifaceted factors, vulnerability factors, trigger factors, more complex. And then you can have spiritual perspectives. But the idea is to offer people choice and to have integrated approaches where possible, where you join up different aspects of someone's being. So they have a spiritual being, they have a practical ways of managing their mental health problems. So the issue is not one or the other, it's about combining things in the most helpful way, if you think about a treatment package or a package of care.
We were talking earlier about, I think one of your questions was about what can community can do differently. And we mentioned earlier about accessibility and more awareness of what happens when you have cousin marriages and so on. Because there is a likelihood that you're likely to get more learning disability, children with learning disabilities and so on, if you have cousin marriages and blood marriages. And I don't know if there's enough awareness. I used to work in learning disability services, so I saw a lot of it. And you find sometimes you have families where they have cousins in the family hasn't married each other, and they have a lot of learning disability within the family. So one family could have 3 or 4 children with learning disabilities, and you can keep telling them this, but they're not really taking any notice, and it's really difficult.
Yeah.
Could I just,
Yeah.
the risk is, just so you know, the risk is actually doubled. Normal, I did a bit of research on this for some project I was doing. Normal chances of having a child with SID syndrome is 3.7, and if you marry your own cousin, it doubles up to 7%. So it's literally doubled. And yeah, I'm very much, they just don't seem to get that. We've been trying for generations.
Even in the Sunnah, it's not really allowed. Even in Sunnah, when you go back to the Islamic perspective, with the
I'm not that religiously educated, so I wouldn't know, but I mean, we're trying to, and again with the mental health thing, one of the things that we do is constantly harp on about it, constantly talk about depression, constantly talking about mental health, how it is important to recognise it. It's not just Zadu and Faglani and all the rest of us. You know?
I think we should have more Bengal, well, not necessarily Bengali, but Muslim, South Asian backgrounds in those fields to educate people. There isn't enough awareness.
Another thing I found is that during, this is common, during the winter period, the autumn period, I get really, really moody.
Season affected disorder.
Brown people, man, we need more sunlight, that's it.
What I would say is this, that awareness and change doesn't come from 1 or 2 or few psychologists or people with their letters behind it. It doesn't work like that. Awareness and change comes from people who are in the community, very much linked in with community. People like yourselves have much more influence than people like me. And it's really important to recognise your own role within your own families, for example. You are probably the person who's most likely to affect change in your family compared to anyone else with all the PhDs.
How can young people sort of approach the elderly community on the topic of mental health? Because I know it's not in our norms and values to talk about feelings and to talk about thoughts. It's very abnormal. So what kind of
Did you say with elderly people?
with elderly, like our parents?
Okay. Yeah, I'm working on something at the moment. I really like to advocate the idea of using psychological ideas in creative ways wherever possible. So elderly people talking about certain things just doesn't make sense in their mind. They've lived in a certain way. They just can't cognitively grasp certain concepts, and culturally they're from such different backgrounds. So what you have to do is use something that means something to them. So for me, I often use music to talk to older people. For example, I worked with lots of men who had had strokes, and they had lots of physical impairments as a result of the sort of cognitive difficulties and physical difficulties, and dementia, actually, Alzheimer's, vascular dementia, and so on. What I used to do quite a bit is use music, something that they could relate to, and talk about that. And emotionally, the music elicits certain emotions in them. And that was a really good avenue to explore things and to think about things which they could do in a way that culturally made sense to them. And I used spirituality. So spirituality they could really think about and really could connect with. So I think we need to finish.
We can have a panel discussion. You can ask a
Yeah.
question with the panel. Sorry about this.
To bring up the World Mental Health Day, I think if we tap into days like that where it's recognised globally, so World Mental Health Day was a week ago. I know it's an annual thing, but if we use those opportunities to engage and stimulate discussion, then at least that's something that's doing something that's just touching upon the topic, and then that can lead to wider discussion.
And I think people like themselves can take that forward and have those ideas and have things. Thank you so much.
Thank you.